All right, everybody, and welcome back to Progressives Abroad, the home of progressive perspectives from around the world. Today on the show, COVID-19. It's everywhere, taking over everything, dominating global health, global economy, and virtually every aspect of global life. The world has found itself in a collective shutdown. Borders, shutdown of businesses, shutdown of schools, basically everything, which is probably why you're sitting home right now listening or watching along with us. Well, today we look towards South America, where many countries have already found themselves in the process of shutdown in order to prevent the spread of COVID-19. In Colombia in particular, it should be going on shutdown just about today. And speaking with us from Cartagena in Colombia is fellow Progressive Abroad, Leinad Joelson, who is a scholar of bilingual education in times of peace and conflict in the region. Please enjoy this extended audio interview, as I hope you have some time to sit back and relax for an extended period during this time of shutdown. And please don't forget to like and comment or subscribe on whichever platform you may find us. Without further ado, I bring you Leinad Joelson. Impending government shutdown in Colombia goes in effect today. Public transport shut down, the curfews have been raised, and the police are out on patrol enforcing this. What does life look like, and how will it affect everyday Colombians? Speaking with us now, we have Leinad Joelson. Leinad, thanks for coming on the show today.
Happy to be here and seeing what's going on. Thanks for having me on.
So Leinad, you contacted, we had a nice interview the other day, and then you contacted me tonight because apparently there's a lot of updates happening in Colombia right now, a lot of updates to the governmental situation and the border situation and everything coronavirus related. So tell us, what's the scoop?
Yeah, I think last time we talked, they were only allowing national citizens in, so Colombian citizens, through the airports, and all the land borders and sea borders had been closed. I think that's the last we had, and we were on partial lockdown, and they're calling it a curfew here. That would be the direct translation, would be a curfew, but it's really just like a lockdown. So what we have now, starting last night at 6 p.m., we just have to stay in our houses until it was, so officially only my city declared it. My city, Cartagena, declared that all the citizens of the city had to be in the house by 6 p.m. on Friday and leave on, and the lockdown was lifted on Tuesday. But
wow.
Last night, the president of Colombia declared that the whole nation will enter a complete lockdown on Tuesday. So as soon as we're supposed to be coming out of our lockdown, the whole nation's going to enter. So,
and what does that look like? Like, what is lockdown in Colombia? Because this word is used a lot, like in a lot of different countries. You say, "Oh, we're on lockdown, we're on quarantine," but I think it means
I think these terms are getting used interchangeably.
Different things in different places.
Yeah, I think a lot of these terms are getting used interchangeably. So I would define the lockdown here. I guess I'm saying lockdown because we have to be in our houses. And the police have been passing through my neighborhood, through my street, checking to see if people are in their houses. And you don't see anyone on the street, whereas normally on a Saturday, all day, you'd have people coming by your house trying to sell you fruit, vegetables, various products. A lot of people buy stuff from street vendors here, as far as things for your house. You can buy, pretty much any fruit or vegetable. You can buy fish, you can buy chicken, you can buy cleaning supplies, you can buy coffee, you can buy newspapers. There are people that come by and like shoe shiners, things like this. So usually you got all these people passing by, like yelling out or singing out their what product or what service they're selling. And you'd have kids playing in the street, playing soccer. You'd probably hear music, people on their patios drinking. But it's totally quiet. And the only cars and motorcycles that are passing are police motorcycles. And normally you'd have cars and motorcycles passing all the time. Public transportation is not running. Taxis are running.
Wow.
And all businesses are closed except for supermarkets. and like corner stores that also sell food and medicine. Um, but yeah, all restaurants, all bars, all non-essential shops like clothing stores, everything's shut down. The mall is closed. Everything.
Wow.
Um, and that's just in Cartagena right now. But the whole country is going to enter into this on Tuesday, and tomorrow at midnight. On Sunday at midnight, Colombia is closing all borders to all people, including Colombian citizens. So
That's incredible.
no more flights at all coming into Colombia from anywhere, and no more people crossing the border from anywhere into Colombia. So, um, and so yeah, it's pretty serious. Um, and I don't know, it's a little bit weird. I don't really know how to feel. I mean, I guess I'm happy about it because I think the measures are in a way necessary, but at the same time, you know, it's always scary when a government you don't trust is basically controlling everything and closing everything. So
Yeah, and I think that's the truth. I think this is I think there's a couple of different situations going on here. It's there's definitely like, there's a lot of people calling saying, "Oh, like people are taking this too seriously. Like it's not that as big a deal as it seems." Like I hear this a lot, and then I hear a lot of people like concerned of like, "Oh, well, I can't believe the government's like shutting us down. This is like a violation of my rights,"
yeah,
and then there's other, and I think, and then there's the other side, and then there's the other side of the situation where people just are kind of like blindly like agreeing with everything. But I think this is like a reasonable approach. Like indeed it is necessary to do stuff like this, most likely. I mean, unless there's some grand conspiracy and this is all just some big hoax. But
yeah,
it's I highly doubt that there would be like massive coordination across all the, let's say it's real, until further notice.
yeah. I mean, it's definitely a
And
real disease. It's definitely.
and
I believe it's a real disease, and I believe people are dying, and I believe people are getting sick for sure. So
that's the thing. Yeah, I mean, I've
I don't
talked
think
to
it's some like I don't think it's some hoax or ruse. I mean, the origin of it. Now we can talk about that, and the spread of it. We can also talk about that. But the actual fact that the disease
Mhm.
illness exists, I think, is not debatable. Um, but no, so you know what? It's pretty because you know what, we had communicated about this yesterday that a group, a political organization that is primarily based in Philadelphia called the Black Socialists of America, that has gained a lot of popularity and notoriety lately in certain communities. And I think they were started in 2018. It's a very new group. Um, a lot of their members have been directly targeted by the FBI. People are getting detained, and Philadelphia is on full lockdown. Um, so that's something you don't like to hear about.
But
Um,
was that related to a lockdown for the coronavirus?
well, the city of Philadelphia is locked down for coronavirus, but the detainment and targeting of these members of this political organization, I don't think has to do with their health. Um, and so And then I saw today too that the Justice Department is asking I think not the Supreme Court, but the federal courts to give more warrants to detain people indefinitely without trial. I don't really know the status of that. I mean, it's a request. I don't know what the process is to approve that request. If it has to be a congressional vote, or if they're just gonna kind of do it anyway, or. But I know there are these things that are happening that I think it's great that people are going into lockdown, and I don't really know what's happening in Colombia because I'm sure dark things are happening as well here too as this country gets locked down more and more. Because Colombia has a long history of various non-state actors and non-state groups, whether they're narcos or paramilitary or guerrillas or a combination of any of those above. So yeah, I don't really know. I mean, obviously CIA has been working in Latin America forever too. So um, yeah. So whenever these,
Yeah, I think that like moving forward, it's like, I mean, I'm very tired, and it seems ridiculous to me at this point that people are still not taking this seriously. Like,
yes,
okay, this is
I agree.
obviously serious, and we should just accept that. And and because there's still so many people that I mean, I was talking to some close family members today that are just, not really not taking it seriously like I think
Yeah.
they should. But I mean, moving forward, I think this is the thing that is possibly of more concern, is like, okay, now we see that like we are becoming dependent on the governments, like in one way or another. Like pretty much every country that is having a lockdown, or there's massive unemployment, there's massive like health problems, and we're all kind of like, in the United States is a perfect example, a place where they don't have a universal healthcare system or any kind of affordable healthcare system, and where like other kinds of like social safety net, social welfare
Yeah.
benefits, these kinds of things are not very accessible, and everybody's just kind of like throwing themselves at the will of the government now.
Yeah.
So I mean, this is where things do get kind of a bit sketchy, when you're like, okay, I hope I can, trust my government in this case. And for the most part, I think most people don't,
Yeah. Well,
a
I would
lot of people
say, yeah.
don't.
So it's interesting in this situation because I would say, on average, I would consider the Colombian government to be extremely untrustworthy, extremely corrupt,
Mm-hmm.
and also disorganized. Um, but it seems like more or less, they're kind of taking pretty swift and strong action on this, which really is kind of surprising, to be honest. I will say I think it's pretty surprising.
Mm-hmm.
For example, so my partner, who is a Colombian citizen from the city of Cartagena, is on a exchange in Canada, in Toronto, for her PhD program. It's a part of it's she was doing some research and an internship there, and she was supposed to come home on April 28th. But we saw the situation progressing, and I was like, all right, well. And then her university there closed, and I said, well, can you ask if you can go home? And the university said, yeah, they gave her permission to go home early. So we're like, all right. So we moved the flight to Monday, this coming Monday, and then all right, flight was changed. Whatever, we had to pay like $30 or whatever to change the flight. It wasn't bad.
Mm-hmm.
And but then on what day was it? Maybe Thursday. No, today's Friday. It was probably Wednesday. The Colombian government announced that they were closing all borders on Sunday at midnight to all people, including Colombian citizens and nationals. And so
Wow.
we looked to see if we could get a flight on Saturday, and we found a flight on Saturday for like $150, which is super cheap, one way from Toronto to Cartagena.
Yeah.
And she told me this morning that she got to the airport and the airline made her fill out a migration form which asked her about her health status and about her address and her contact and emergency information, her what insurance company she has for coverage, and she had to fill that out. And she's on a flight. She arrived in Panama, and she's going to come here tonight. So the interesting thing that's happened is this afternoon, the Ministry of Health in Colombia called our house, our landline, and they gave us information about my partner's arrival, what she needs to do when she arrives, how to be safe, how to be clean. They also said that they're going to transport her to the house from the airport and the other people on the flight. And also she said there's only 8 people on the flight. And this is not like the government flying people out or whatever, a private situation. Like there's just 8 people booked on this flight. That's it. And so the people who arrive are going to get transported to their houses by the Ministry of Health. And they gave me a phone number that we can call, and if she presents symptoms or anyone in the house presents symptoms, that the Ministry of Health will arrive to the house and do the exam for free, to see if you test positive for the virus. And so, I mean, that's what they said. Who knows how true this is going to be? Because I mean, it's pretty serious, I guess, because they called the house and offered us this service, and
Yeah, that's incredible.
But I was pretty surprised and impressed, I will say, because I would not have. I don't know. It just seems like very uncharacteristic of the government here, in my opinion.
Yeah, this is what's very interesting to me about this whole thing, is that, I mean, of course, different governments are reacting differently. taking different approaches, but in general, it seems like it's being taken very seriously, and like worldwide, like global organization, or like globally organized, more or less, that this is, super serious, which it is. I mean, I think this is not an argument anymore. But that's pretty incredible that, I mean,
Yeah,
they're providing all these services, and I mean, they really want to try to stop this, because I mean, I'm just looking at how many. Yeah, right now in Colombia you have a total of 191 recorded cases,
yeah,
which is a lot. I mean, we talked like 2 days ago and it was a lot less than that, like a lot less.
yeah,
And you've had 51 new cases just today. I think last time I talked to you, it was something ridiculous, like, 13 cases in Colombia or
yeah.
something.
No, there's 30,
So
30 last time we talked. 30.
yeah, so
Yeah.
it's that's pretty. Yeah, so I mean, I mean, but what the population of Colombia is quite big, though, I think.
Yeah, it's 55 million, I think, officially. And, I think there's probably a lot more than that, probably into the six. And we also have 2 million Venezuelans now that I do not think are being
Okay.
counted in the population. But,
Yeah, so we're
this.
talking we're talking about the what's up?
No, I'm sorry. Well, all the neighboring countries are also closing their borders. I know Ecuador and Peru all have their flights and borders closed.
Yeah, I think, most places are doing this now. Now here in Norway, for example, the only people allowed in are citizens and like permanent residents. But like, I mean, I think most of those people are back now. Like a lot of people are being like repatriated and stuff.
Yeah,
And if so, you need to go in a 14-day quarantine,
yeah,
which is basically just hanging out at your house. It's not like you're sitting in like a cell somewhere or
yeah,
something. But
yeah.
yeah, one thing one thing I wanted to ask you was, what's up with, because there's a lot of migration going on between Venezuela and Colombia. So what's up? Is there any word on what's happening with these people who are, coming over the border, or you
Um,
know living nearby? Is it
I
that
mean,
border shutting
I
down?
think in general they have a pretty precarious and vulnerable situation in the Colombian society because they are allowed to come in. The government allows them to freely enter, but they don't give them any documents. So,
Mm,
um, so it's really hard for them to find work, and it's hard for them to rent apartments. And so a lot of them live in the streets or they pay daily rents. Like
mm.
there's places you can rent like a room for a night and you get like they're not. So I mean, someone who's like begging for money on the street here could probably get about, let's say, like $10 a day. I think like people are pretty open to giving these people money. I see them, get a good amount of money here and there. And these rooms that they rent are
um
probably around $4 or $5. So, and you get like it's probably just a bed and a bathroom, and um, so they probably have like 5 or 6 people that stay in these rooms. But I mean, as far as health, I don't really know. I think they can get some of them get health treatment. I know. Um, and but yeah, I think for the most part they just kind of live on the street.
Yeah, I'm just wondering, because I mean, they've been, you've been hearing a lot about this in Southern Europe, especially, and also in the United States. There's like a lot of like migrants coming, like and a lot of like undocumented people, and this is a big concern in the way of like these people, are scared to go seek health care.
Yeah,
And if they get sick, then they're not going to be able to, they most likely aren't going to seek health care because
yeah.
they don't want to show themselves to the government.
The situation's
Um,
different here because they're allowed to be here.
mm,
They're allowed to be
yes.
here
Okay.
without
Yeah. But
documents.
okay. Yeah. They're allowed to be there. They just don't get documents. Okay.
Yeah, they're allowed to be there without documents. So they're not afraid of getting kicked out of the country unless they commit a crime, probably, which would be like robbing someone or whatever.
I mean, this seems so smart, to, allow these.
Dude, like, there's a lot of really interesting progressive facets of this society because the people here are very. I mean, I would say most Colombians I know are pretty open to the Venezuelans being here. You've seen it start to go downhill like pretty quickly. I would say in the last 6 months to a year. But it's nowhere near the level of xenophobia we have in United States or Europe. I mean, the people, like, the thing is that people get on the buses all the time and, like, they, tell their story, and maybe they try to sell you, like, some chocolates or a bracelet, but they're doing this on the bus. But basically, they're just asking for money, because really what they're selling is not really of interest of anyone, and they don't give it a price. They say, like, you can, like, take a piece of candy and, like, pay what you want to pay, basically. And people give them, like, a couple coins or whatever. Maybe they give them, like, $1, but I mean, the people are pretty respectful and open. They're not like, go back to your country, like try to get a job. And like some people hand out their resumes too, which is pretty cool. People on the bus will they'll go like, I'm from Venezuela. I just came here like 2 weeks ago. Here's my resume. Like I was an engineer there, or I was a math teacher there, or
Is there any kind of like camaraderie or like
absolutely
sense of between like Venezuelans and Colombians?
Absolutely.
And like what would you sense would be like, for example, like, okay, there's not I can imagine, and I don't know why, but I can imagine there is or I want to hear from you. I can imagine there's more camaraderie between people from Colombia and Venezuela than there are people from Germany and Italy, or people from United States and Mexico or something.
Yeah, I would compare it more to like U.S. and Canada.
That you would say that's the kind of relationship,
yeah. They're like oh, I mean, it's a different country and different stuff goes on, but it's pretty similar in a lot of ways, and they share a lot of cultural and social.
Yeah, I mean they share language and
their religion, share religion. Also, just like share climates. Like that's Venezuela, like climate wise, is very similar to Colombia, age wise. History and whatnot. Definitely camaraderie. And so with these people, I don't really know what their health situation is, but I know that they've closed the border now. They closed the border to Venezuela like 2 weeks ago, so they're not letting any more Venezuelans in. As of 2 weeks ago, that was the first border to close. The first border to close was Venezuela. Then it was and then it was Ecuador and Peru and Brazil, which are other borders. And then it was the ports, like no more boats coming in. And so there was like a yacht, I think, with like a big sailboat with maybe 15 or 20 people on it that were doing kind of like not like a cruise, but like a personal, like a group of people, like a family,
like a sailing trip.
Yeah, like a sailing trip, and they were going around the Caribbean, and they were supposed to come to Cartagena, and the government was like, no, you can't come in. And so then they were kind of like in limbo for a while because Panama wasn't taking them either, and Aruba wasn't, like the other islands around here, like no other island nations were taking them in, and I think Panama finally took them in a couple days ago, but they were kind of stranded. And so another interesting measure that's being taken, I think this one will not stand because it's very controversial at the moment, so the mayor of Bogota. So Bogota is the capital of Colombia, one of the biggest cities, I think, in the world, probably in top 30 biggest cities in the world. Huge city, bigger than New York, like maybe 10 or 15 million people. So that's, that's where it's the capital, it's the financial hub and everything. And so the mayor of that city, she said no more people are coming into the city, even people that live in Bogota and are from Bogota. Like she was like, if you're not in the city right now, you can't come in. Like we're closing all our like bus terminals and everything. And so, but that's been received, I think, very poorly overall. So I think that probably won't stand. But because Bogota is a big city. In a ways, I would say like structurally and culturally, it has a lot of similarities to New York. Like when you're in Bogota, if you like closed your eyes and they dropped you in the middle of downtown Bogota, you could be like, all right, this is any major European or world city, any major, like it looks like New York, it looks like London, it looks like Paris, it looks like Milan, it looks like Tokyo. It's very big and developed, big avenues, transportation system, metro and whatnot. Um, so, but it's huge, and obviously too, because it's in a developing country as well, that there's large, even though the main area is very developed, and there's a lot of areas that are very developed, and a strong middle class, there is definitely a good 15 to 20% of the city that lives in pretty precarious conditions, and live on top of each other in these like kind of like favela type neighborhoods. And so obviously the spread of the virus in this city would be pretty catastrophic, I think.
I'm really surprised to hear that they actually shut down the whole public transportation system in Cartagena. Um, that's actually that's much more drastic than what's going on here. I mean, to give
And
to just like yeah, what were we?
like I see the thing is too, like the police are out on patrol. Like I would say my neighborhood, you could go days without seeing the police go down my street. Um, and I've seen them go by pretty much every hour
Wow.
today.
And is there some kind of penalty if you were out during this curfew hour?
That's an interesting question. I think officially, yes, you get like a ticket, or if you're like on a motorcycle, you might get your car or motorcycle confiscated. Um, but the thing is, the way Colombia is, I think that probably won't happen for a lot of people. I think they'll either give the officer some money and he'll just let them go back to their house, or he'll just say, like, go back to your house and stop being an idiot. I can't imagine they're going to confiscate many people's cars and motorcycles or give them tickets, because the thing is, a ticket would probably be maybe $60 or $70 or something, and that's a lot of money for people here.
People aren't going to pay that.
Yeah, exactly, and especially it's kind of like a douchebag move to give someone a ticket, when they're
maybe the police are just out there kind of for reinforcement
to discourage maybe people from who are thinking about going out. I have seen a few people in the neighborhood out walking around, but really, a fraction of a percent of what it would normally be. There's like 1 or 2 people walk by my house every hour, where normally it could be like 30, 40 people in an hour.
I have to say, it's very strange. It's very strange here because, now we're on like, I think already like day 10 of this like nationwide quote unquote lockdown or quarantine or whatever. And I mean, we followed a lot of the same kind of ideas, like, shutting the border, shutting the ports. Public transportation still running. Most like non-essential businesses are closed except for like some kind of restaurants and bakeries are still open with like you have to, only for takeaway, and like only one person can come in at a time. But most places are just closed. But I'm kind of disappointed a bit with the people in general, like at least in my neighborhood. I mean, I still see people out just like all the time. I had not been to the supermarket in about 10 days, and like the last time I went to the supermarket like 10 days ago, you could tell there was like a bit of like a kind of panic going on, like, because a lot of people were shopping, doing some big shops, and there's a lot of things flying off the shelves. Not like to the scale what we've seen in United States, but for Norway, which is a relatively calm place. But now I went to the supermarket today, and it's like just like a normal day, and it's a bit disappointing and disheartening, because I'm just like, this pandemic is just getting started.
We're like, we should be like buckling in and getting ready for what's gonna happen next.
Yeah, I mean, I've been pretty much living like a very cautious prisoner of my apartment right now. And it's been fine. I mean, I've been keeping myself busy, but I mean, going out very rarely, maybe. I mean, I feel a little guilty that I go out for like a jog every day, and I don't touch anything, and I don't think there's any problem with that, but I just don't want to encourage other people to go outside. So I'm a bit uncertain about the future of Norway right now when it comes to this virus, because we're supposed to be on lockdown till March 26th, and I'm not sure what the government's going to decide. Are they going to lock down even harder? it's just not of the government and of the mentality of the people here to be on lockdown. Like you can't tell people what to do here. They're not gonna they're not gonna
Yeah.
go with it. You just got to kind of let them do what they do, and it generally works out okay.
Yeah.
But it's strange.
Yeah. Well, it's
Um,
interesting because I in the last few days since I think we last talked, I've talked to two friends of mine. Well, actually, my sister one, and then my friend who lives in New York, and I talked to my sister who is in Tampa, and my friend who lives in Orlando. Like New York City, is I think the epicenter of the U.S. outbreak at the moment. Said in New York, everything's pretty much running like normal. I mean, there's noticeably less people, but it's not any way or shape or form shut down. And my sister today took a flight from Tampa to Boston, and she said the airport was packed, everybody on top of each other, planes are full, lines are huge, and I was just thinking, I'm like, this is, and then my friend who lives in Orlando, he's a teacher, and his partner is a student at a university. So both of them have been, their classes were canceled, and so they've both been home for about 5 or 6 days now. But they said their neighbors and the people around them are just, still going on as normal. And so basically, what I've been hearing from the United States as a country that has many cases, obviously it's a huge population, but it has many cases and increasing every day, does not really seem to be closing down. Where I'm in a country, also big country, not nearly as big as the United States, but very big country. And we have relatively few cases, but we're closing down very quickly, and the United States just seems to be going at least, like, I would say 30 or 40% steam, not full steam, but like 30 or 40%. And so it's a worrying situation from what I've been hearing from back home. And so
I guess I don't know, we'll have to see what happens. It's like really right now, everything is changing day by day, and a lot of these weird kind of fantasies, like, I don't want to say fantasies, but imaginations that we may have had in the past about, oh, what would happen if there was a global disaster? How would people react? Now it's playing out.
yeah.
So we'll have to see what happens.
And yeah, and I think it's interesting too because it really hasn't gotten that. I mean, it's definitely bad, but like I think the worst is still yet to come, unfortunately. And so we'll see how people start behaving. Hopefully, it's a way for us to come together and work together and make sure that we take care of each other and start looking for solutions for not only the medical issues but the economic issues and the social issues that this is impacting.
Oh, and indeed it will.
Seems like Italy's doesn't have anything under control at the moment, and so maybe hopefully that's not to come in. Spain's also, I think, pretty much out of control. So
it's out of control. I mean, this is an example of places that do have fairly decent healthcare systems, like
and
very good
infrastructure
healthcare
and education and systems.
all that stuff.
Yeah.
We'll notice in a lot of these outbreaks is that they always occur right after major events. So in Italy, it was really this whole carnival.
Yeah.
Carnival happened, and then boom, like right after the massive, the levels, the amount of cases went up.
Yeah.
And in general, in Europe, the outbreak really started to spread around the rest of Europe right after they had their like winter break here. They have like a winter break in like February, right around also when. So of course, a lot of these people from the north, like Norway, Germany, all these places, they all went down to the south of Europe to get sunshine. And who knows, maybe someone from up here brought it down there. Maybe it was down there already and people brought it back up here. I mean, it's really easy. And Europe is such a small, condensed area with such a ton of people living in it. There's like 500 million people living in the European Union, you know?
And smaller than the US.
So
it was like 350.
So I mean, anytime. So I have this feeling like there's a big outbreak coming right now in relation to like St. Patrick's Day celebrations from last week in the United States.
Yeah, and spring break.
Yeah, I think Colombia is taking the right steps. They're learning from the actions, the unfortunate actions of the countries that got hit before them.
The quote unquote developed world.
Yeah, and I think that's a good place to leave it today. Leinad Joelson, thanks for coming on the show again. Everybody, thanks for tuning in today. We'd like to thank Leinad one more time for coming by the show. And this is actually part of a bigger series of interviews we've done with Leinad about life down in South America and in Colombia. So you'll be hearing more from him soon. We really hope you found it educational and informative, and if anything, entertaining while you're sitting here in quarantine today. With that being said, please don't forget to like, subscribe, or do whatever you got to do to come back again next time on Progressives Abroad.